Hi, I'm Dr. Vandal and I joined FCS in 2014. So I was with my mom when she decided to go back to school and become a registered nurse, and she did rotations in all the specialties of medicine, and she fell in love with oncology. And she would come back and tell me stories that she had between her and her cancer patients, and the relationship was just so profound and so beautiful. That's how I started to get very interested in pursuing oncology as a medical physician. And then in med school, the studies of it intrigued me even more. So it just kept growing, my passion for oncology. My mother was a chemo nurse for about 15-20 years at FCS, and then she left for a couple of years to get her nurse practitioner, and she came right back. And I would keep coming to visit her at work when I'd be in town, and I got to know the doctors here, the nurses here. And yeah, when I graduated, FCS offered me the job and I took it right up, and I got to work with the doctors I knew, the nurses I knew, and my mom as a nurse practitioner. So it was a comfortable landing ground after just graduating from fellowship. As far as specialties, I treat everything. I'm a community oncologist and I'm here for the community. I treat breast cancer, colon cancer, prostate cancer, lung cancer. I treat everything, and I like having that variety. If I were just to specialize in one, I would probably honestly be bored. So I like that I have a widespread range of malignancies to treat, and I'm constantly reading to make sure I'm up to date on the latest and greatest, and it's fascinating and it's always interesting, and there's always something new coming out. So I love that I get to treat everything. My family's originally from Venezuela, but a lot of us were born in the United States because everyone was at university or whatnot. But when we moved to the United States permanently, we all lived together, and I grew up in a bilingual household, Spanish and English. So I have the blessing of speaking both Spanish and English, so I do have a large Spanish population as well. And it brings them a lot of comfort to be able to understand what they're getting treated for, what the stage is, what the pathology. It brings them much comfort to know that they'll be able to understand more clearly if Spanish was their first language and English is a little tougher for them to understand. I definitely follow the science. I follow the National Comprehensive Cancer Guidelines, the standard of care, the latest and the greatest. I individualize each treatment to the person I'm working with. And I always want them to tell me about their side effects, and I want to hold their hands to support them through the treatments and make sure they get through the treatments definitely as safely as possible, but then as peaceful and as comfortably as possible. So I want them to know that. I'll be there for them and help carry them through.